Hey Queens, welcome to the Sister Circle podcast, a podcast dedicated to providing candid conversations, information, and resources regarding women's health, mental health, motherhood, and wellness. And I am your homegirl and host, Fertility. So go ahead and get comfortable, Queen. Let's dig in. Hey Queens. So I've got a goodie for y'all today. I am having a conversation with Dr. Sandra Alexandria. She's someone who's really special to me as she was extremely instrumental in helping me during my infertility journey. She was the first doctor who really took a look at my symptoms and didn't brush them off, but instead really helped to get down to the root causes of why I'd been feeling the way that I had and helped me prepare both my body as well as my womb for pregnancy. So Dr. Sandra Alexandria is a chiropractic doctor, certified nutrition specialist, and massage therapist. She uses an integrative approach to patient care, combining her background of functional medicine, chiropractic medicine, clinical nutrition, and acupuncture to address root causes instead of just symptoms. She has a special interest in gastrointestinal disorders, environmental medicine, nutritional and micronutrient therapies, hormonal imbalances, chiropractic care for pregnant women, including preconception care, fertility and pregnancy support, and female health and wellness. So listen, the next hour is filled with gems. So go ahead, get out your notebook, open up your notes app on your phone, and get ready to learn something new and helpful. So let's get into it. So I am so happy to have Dr. Sandra Alexandria on the show and to just share like her wealth of knowledge with us. So who is Dr. Sandra?
So I found myself in this profession basically having my own health issues, and I sought out care, and I couldn't get answers. I was always told, oh, your numbers look great. Your labs are great. Oh, you're the ideal patient. Everything's perfect. I'm sent away. And I would always leave that appointment like, am I crazy? Like, how come I feel the way I feel? Like, I don't feel well. And so this is how the whole journey started. And that's what pretty much led me to chiropractic medicine is I was looking for a physician that can help me with my own health. And through the changes of lifestyle and diet, I saw a complete turnaround in basically what was determining my health. And I realized if I was able to turn my health around with just some, simple lifestyle changes and avoid being on any heavy medications for them instead, like there was more people just like me out there. And that became very apparent. I've seen it even with family members as well, where I watched instead of their disease being managed, it's just been perpetuating, and it just keeps getting worse and worse and worse over the years. And now it's, let's give you more medication for this. We need a different one for this, instead of just kind of stepping back and saying, hold on a second, where is this coming from? Where's the root of this? Is there something that like started this? Where did it perpetuate from? Can we remove that obstacle and then restore that person's health? And I found that to be true for myself. And I was just in awe how much I was able to completely turn my life around. And that's what inspired me to go back to school, become a chiropractic physician, and provide that for other people.
That's awesome. Really awesome. I think that you having a connection and having had experiences, in your personal life, and allowing that to inspire you to do this work makes a whole lot of sense. So I remember you were a huge part of my healing journey, particularly when I felt probably least well in my life. I remember having just had an open myomectomy surgery, and my prayer was that, God, send me the people, the resources, and the tools that I need to heal my body. And so one of the things that I promised myself was that I was going to find a therapist. And I remember reaching out to maybe about 5 or 6 therapists, and 6-7 days had passed by and no one had responded. So I went back to, what was it, Psychology Today. I found another supposed therapist. She seemed a little bit coachy, but I reached out to her and she called me back maybe in 15 minutes. So I went to go see her. Can't tell you her name to this day. But I remember when I was there, she told me that she taught a yoga class next to this wellness studio, or a wellness clinic, and that I should, check it out. I was like, okay. And so that's actually what led me to you. And I remember at the time that I met you, my hormones were all out of whack. I had a hyperprolactinemia, where my numbers were like a 91, and the average range is supposed to be from like 1 to 12 or 1 to 13. I had a bald spot in the back of my head. And I had gained probably 20 pounds in a matter of like 3 months. And mind you, I'm 5'1". And so I remember I came to you and you said, okay, well, listen, where we're going to start, you read over my labs and you said, we're going to balance out those hormones and we're going to get your uterus prepared for pregnancy. And here's how we're going to do it. So I say all of that and I give kind of like that bit of context because you were truly a part of my healing journey. And I think that had it not been for many of the things that I had done with you, I wouldn't have had the outcome that I had. Even my doctor, my OB-GYN who delivered my first daughter, she said, Faith, I had no idea what I would see once I opened you up. And I was amazed that you had like absolutely no scar tissue. And so, that's kind of like where Mercier Therapy came in. But I want to know a little bit about what role do you feel that imbalanced hormones, obesity, and other issues like metabolic syndrome play in addressing someone's journey to optimal health, whether they're seeking pregnancy or not?
Right. So the hormone imbalance, this kind of goes back to even that story I told you about the patient who I had to educate her about ovulation, right? Hormones are so important because someone who's trying to get pregnant, the first step is figuring out when do you ovulate. So if your hormones are all over the place, you may not be able to track that ovulation. You may not even be ovulating at all. So that's huge right there. That's your first step is let's figure out when are you ovulating? And it's not just so simple as let me just download this app and my period comes every 28 or 38 days. And so I'm going to ovulate on day 14, but it's about educating yourself on that cycle and then understanding, you can use things like cervical mucus. So what is it, the cervical mucus that you're looking at? What does that even mean? And so understanding the different types of cervical mucus, and they can have a variety of color and texture and consistency. And that when you have that egg white mucus, that literally is like that sticky, tacky white of your egg, that if you were to, put it between your fingers and kind of tap with it, that would be that ovulation mucus. So that would be an indication you just ovulated. Or other options are to use your basal temperature. Mm-hmm. So, that's a woman would take their temperature throughout the entire month. It needs to be done first thing in the morning. So literally before you even get out of bed, you roll over, you take that thermometer, and then you're going to want a special thermometer that has the extra 1/10 of the degree on there. And you take those measurements. And then when you ovulate, you're going to see a little blip in your temperature that spikes during ovulation. So now you can start tracking and see, you know what, I ovulate on day 10, I ovulate on day 16, or wherever it is that you ovulate. And then if those things are too much work for you, you can actually buy strips that will test for the luteinizing hormone that will tell you when you have a spike in luteinizing hormone, this is when you just ovulated. Mm-hmm. So that's first and foremost is you need to figure out, are you even ovulating and when is it? Because if you can't figure that out, you're going to have a really difficult time conceiving if you don't know if there's an egg there to even be fertilized. So mm-hmm. Hormones play a huge role in that. And managing somebody's hormones is there's multiple steps to it, because now, we talk about root causes. So why does this person have an imbalance in the first place? Right.
Mm-hmm.
So, could it be things like, obesity that can drive an imbalance? Absolutely. You can see, there's other conditions like, polycystic ovarian syndrome, where that can be driving the imbalance. It can sometimes be as simple as somebody is under extreme amounts of stress, and that's what's creating their imbalance. And so then, if that is truly the root cause, we can try balancing hormones, whether we give you topical hormones or, whatever type of botanicals to help balance. But if we don't address the root cause, we're just kind of chasing our tails. And so, is it someone who needs to learn how to better manage stress? Is it something in someone's life that's really driving that they need to actually, having someone like a therapist help them through and coach them on how to better deal with these types of stressors, so that way it's not having such a negative consequence on their body? That might be part of a treatment plan as well. So it's not always just, okay, you have a hormonal problem, let's give you the right hormones and fix it. But it's, hey, let's step back here. Why do you have this in the first place? Mm-hmm. And so that's kind of where we peel back and look at hormones from that aspect. As far as things like obesity and the metabolic syndrome, obesity you usually will see with things like metabolic syndrome.
So what exactly is metabolic syndrome?
So metabolic syndrome is going to be a combination of different findings together make up metabolic syndrome. So obesity would be one of them. So having that elevated BMI, having that hip to waist ratio, having that elevated would be one of those findings. Having things like dysregulation of your blood glucose, high cholesterol, high trigs, would also be high blood pressure. So when you get all these things together, now you are looking at what we call metabolic syndrome.
Got it.
So it's not just one of those things, it's all of those things. And you take something just like obesity, you're going to see this person with obesity is going to be more likely to have issues regulating a normal blood pressure. So now you have this elevated blood pressure. And as far as from a pregnancy standpoint, those just put you at higher risks. So now you're at a higher risks of having complications with your pregnancy, higher risk of having complications with the delivery. So before even considering pregnancy, these, if you fall into any of these categories, these are things you should be taking steps towards to improve as part of your preconception plan. Let's get you a healthy BMI. So that may involve a weight loss program, or maybe it involves, some people struggle with when we categorize it as weight loss, but we can say, let's have a healthy eating program. And by default, you're going to end up losing weight once you start eating these foods.
Gotcha.
Type of thing.
What type of role does sugar play in all of this?
So sugar, basically, the sugar that's not utilized, you take in excess sugar and then that goes and gets stored as fat. Mm-hmm. So now the excessive fat that you have, guess where all those excess of hormones like to hang out? In the adipose cells. So you can have an excess of things like estrogen, too much estrogen, testosterone, any of these sex hormones that are, they're fat soluble and they're actually made from cholesterol. And so they like to get stored in the fat. So sometimes just losing some weight can be part of that protocol, like our treatment protocol for a patient to balance their hormones. Mm. Yeah. So the sugar is going to be an issue as far as like the obesity, like I mentioned, the fat storage, but also how is your body handling the glucose that's being taken in? Mm-hmm. So are you able to, do you have enough insulin to get the glucose into the cell so it's not just floating around in the bloodstream? Because then this is where things like diabetes come into place. Mm-hmm. So somebody who already has, this metabolic syndrome, or they're trending towards that, even preconception, there's a good chance you're going to end up with gestational diabetes, which now just complicates your pregnancy even more.
Got it. So tell me this with regards to like hormones, like what are some of the signs that may point to um having an imbalance of hormones? So I know that one of the things that kind of really scared me, and at first, when I thought about hormones initially, I always thought about my thyroid. So I remember when I initially was gaining all of this weight, and then I had like this bald spot in the back of my head the size of my fist. Those were like two signs. But what are some others that folks might experience that may point towards a hormonal imbalance?
Well, and keep in mind, different hormones have different effects on the body. So, when you see something with like you mentioned the thyroid, and someone has an imbalance in thyroid, you can either have a hypo or a hyperthyroid. And so the symptoms are actually complete opposite. Not always, but for the most part they are. So for example, someone who has a hypothyroid, you may see them struggle with losing weight. If they're trying to lose weight and they really struggle to lose weight, or they haven't made any changes and all of a sudden there's this excessive weight gain that happens for them, are pretty common. You'll see low energy level. So if you think about thyroid's responsible for metabolism in the entire body. So if there's not enough of that thyroid hormone, metabolism slows down. You feel sluggish, you're tired, slow, can even be brain fogged, a little bit difficulty concentrating type of thing. But from your cycle standpoint, you may start noticing that you have irregular cycles, or it can even be very heavy cycles that you typically would see with a hypothyroid. And then other things like hair loss, depending on where you're losing the hair. Sometimes it's just on the top of the head. Sometimes you'll actually see people losing hair in the form of like their eyebrows. Sometimes it's the skin. You have this dry, itchy skin that's just completely unexplained for no reason, and you can't seem to relieve it with whatever lotion you're using. Can also be a thyroid dysfunction. But keep in mind some of the other hormones. If estrogen's a problem, you might end up again having some excess midsection weight that you can't seem to get rid of, or it just came out of nowhere. Sometimes you'll see elevated testosterone in women and they start experiencing some facial hair growth, or that also would have some hair loss associated on the top of the head. Maybe acne, never had an acne problem, and all of a sudden you're breaking out on your face, on your back, different parts of the body. So it could be so many signs and symptoms of a hormone imbalance.
Gotcha. So one thing like around testing. So I remember when I first had gone, I found a doctor, I'd gone in and, I said, hey, I want to get, my blood work done. Didn't know exactly what all that entailed, but I just told her that I wanted to get my blood work done. And she, my labs come back and she's like, oh, everything is good. And I was just like, no, similar to like the story that you were sharing, like, no, there's no way that I can be okay. And I feel the way that I feel. And I've had the symptoms that I've been experiencing.
Right.
And so I wound up finding another doctor who was actually the doctor who wound up treating my fibroids. But he asked me a couple of questions, did some examinations, and he said that I had PCOS, but I didn't have cysts on my ovaries. And then he also discovered that I had this, very high prolactin level. But my question is that like, I remember when I came to you, like testing was one of the first things that we had done. And so I'm curious to know, like, what should you be getting tests for? And how do you go about getting the accurate test or blood work done so that you can, see someone to assist in your wellness ultimately?
So I guess to answer that, if we're talking in the sense of fertility and someone who's trying to get pregnant, and you're going to your doctor and you're saying, I want to get and let's just say this is preconception care. Most of your doctors aren't going to do as thorough of testing if you just started trying to conceive and you haven't had any success.
Right.
Typically they'll say, under the age of 35, if you've been trying for 1 year and unsuccessful, now you can be considered having a fertility issue. And then when you're over the age of 35, they'll say after 6 months of trying unsuccessfully, now it can be considered a fertility issue. And then would they look more in detail at your actual hormones, like figuring out like your follicle stimulating hormone, like what your hormones would be tested on different days. So you would want a day 3 for some hormones, and then a day 21 for other hormones to see where your hormones are moving throughout the cycle. So someone for fertility reasons, those are going to be some of the things that you're going to want to look at, not just, okay, I had a standard physical and they checked my cholesterol and my liver function and kidney function and my blood cells and everything is good, because that's pretty standard. But sometimes it's even, you have to even ask for more information when you're in for that test, for that physical. So maybe, a lot of people will include a vitamin D, which I think it should be standard, but some people won't include that. And you might have to ask for that. Or someone who's trying to get pregnant, their B12 and folate should be tested. And that's a really simple test that can be ordered from any doctor. So sometimes you just have to request it and understand that I am trying to get pregnant. I would like to have these things tested for my wellness.
Gotcha.
And really that's the whole purpose of a physical anyway. It's wellness. It's making sure you're healthy and well. And if something's abnormal, that it's an opportunity for you to engage in preventative care and maintain your wellness.
And, I think that one of the primary reasons that I asked the question about like requesting, specific types of tests or blood work to be done is because I know that I don't see like a quote unquote normal primary care physician, because I go to an integrative doctor, MD.
Right.
So, when I'm not feeling well, or if I'm displaying all of these symptoms, she's going to run, a huge number of tests to make sure that we get ultimately to the root causes of why I'm feeling and exemplifying, X types of things. So that's actually really good to know. So I think that the knowledge and knowing that is also like a method in which we can really advocate on behalf of our own health too. So tell me this, like, what would you say women can do to really optimize their health prior to pregnancy? So you talked about the balancing of the hormones, and you talked about, just, understanding your reproductive system. But what are some other ways? Like, for example, how might nutrition play into this?
So that's a really good question. And that's actually, nutrition specifically is something that is just a fundamental that I would counsel patients on that are undergoing preconception care. So the idea is, during this time period of your preconception care, give yourself at least a minimum of 6 months. Ideally, you would give yourself about 9 to 12 months. I realize sometimes patients are coming in, they're like, I've been trying to get pregnant and it's not working for me. And they're wanting to be pregnant yesterday. And it's like, hold on a second, let's just back up and we need to start over and start fresh. So we're not trying to get pregnant right now. If you were to get pregnant, fine, that's great. But just let's take some of the stress off, and you got to prepare the space first. Mm-hmm. So think of it like you're moving into a new house. And you're not going to just, I don't know, maybe some people do. They just, you signed your lease or you closed on your house and you just packed your stuff up and moved in and like, here we go. I would say most people probably say, hold on a second. I want to do a deep clean in this place before I get my stuff in here. And let's get this room painted, and let's establish over here what we're doing in this room. And then we'll move all our stuff in.
Right.
Is what most people would do. I know that's what I would do. And so then essentially you're doing the same thing with your body. You got to prepare the space. So preconception wise, first things first is we need to look at you nutritionally. So what do you eat? So, it's a very interesting thing because, we're in the society with the standard American diet. And yet we have highest numbers of obesity, but yet we have malnourished people. And it's like, how can you have so much obesity and malnourishment? And it comes down to the quality of our food. So now we have to look at, what does this person eat? And if you are eating a standard American diet, you're eating a lot of manufactured, overly processed food. And the issue with that is that the nutrient that was once in that food has now been completely stripped out of that food. So for example, if you were going to read your label of, I don't know, pick up your package, any bread, Wonder Bread, or a pack of crackers, or any manufactured processed food, go ahead and pick it up, and you're going to look at the ingredient list, and you're probably going to see something along the lines of enriched flour. And enriched flour means that that flour has been so processed and manufactured that all the nutrients that would have been found in that grain has been stripped out. So now what they've done is they've enriched it by putting back in the vitamins and nutrients that would normally be in that flour. So the problem is that what they're putting back in is a synthetic form of the vitamins. So now when you're reading your label, it says, enriched flour, and then you'll probably see in parentheses right after, it's going to say things like niacin, riboflavin, and then it starts listing all these vitamins. And so those are the synthetic vitamins that were put back into the food. The problem is that your body doesn't recognize that synthetic vitamin the same way it would recognize it if it was the vitamin found and that nutrient found in that food, the way your body would absorb it, take it in, and utilize it. So now you're eating all of these basically empty calories that are not really they're not nutrient dense at all. And so this is how you can have something where there's this epidemic of obesity in our country, but we have malnourishment, and you see these elevated levels of different types of preventable diseases. So that's first and foremost, is let's look at what type of diet does this person have? What are they eating? Are they eating the standard American diet? They're going to need some counseling, and it's not something that's easy for people to do. When you tell somebody something they've been doing their whole life that they need to change, like, well, what do you mean this is what's making me sick? Like, that can't be. I've done this my whole life. It's like, well, exactly. That's kind of the problem here. We need to change this. So it's getting someone on board to start eating a nutrient-dense diet.
And so what would a nutrient-dense diet generally look like? So I remember one of the things that you, I'm going to say that you took away from me, or that you suggested that I no longer ingest, is oil.
Well, we were doing a specific protocol. So
okay.
I wouldn't say that would not be something appropriate for like a balanced diet, because you do need oils.
Okay.
We were working on something specific as far as trying to get you into a quick weight loss to get your BMI down.
You're right. Okay.
So that was the purpose of utilizing that. But oils, though, however, they need to be the right kinds of oils. And so if you remember, even in that type of protocol diet we were doing, you were still eating healthy oils in the sense of things like avocados.
Right.
And if you're eating things like eggs, you want to make sure you get the egg yolks. And then having things like coconut oil and olive oils and avocado oils and different type of nut oils, instead of having things like peanut oil, soy oil, canola oil, corn oil, which are all inflammatory oils, as opposed to the oils that are high in mono and poly unsaturated fats.
Interesting. So oils themselves are inflammatory. Certain oils, like the canola oils,
certain oils. So oils that are abundant in omega-6s are going to be your inflammatory oils.
Interesting. Okay.
So those are things like your like I said, peanut oil, soybeans, corn oil. And you see a lot of people will cook with peanut oil. It's so cheap. That's why they do it. Same thing, even, canola oil. That's not even a plant. It's an acronym for, I always forget what the acronym, basically coming from Canada. But it's rapeseed is the plant that canola oil comes from.
Oh.
So a lot of people don't know that. And it's a inflammatory type of oil. So those are the kinds of oils we were having you pull out. You're pulling out of the diet. And then when you are adding them back in, you want the ones that are basically high in omega-3s. And so then for some people too, it's incorporating more fatty fish into their diet so that they're also getting those types of nutrients. So fats are one source. The other good sources of fats are going to be things like nuts and nut butter, not peanuts though, but like things like walnuts and almonds are excellent sources of fatty acids, and they're anti-inflammatory. I mentioned avocados, using high quality oils, even just raw. So after you've already cooked your food, you can just drizzle them over raw. And then fish and other seafood like sardines and fatty fishes like mackerels and other fatty fish can also be useful. Sea bass is a fatty fish, salmon, to get some of those omega-3 fatty acids. And then other plant sources can even be things like flax is a good alternative for, I know some people are vegetarians and need to find other plant sources for their nutrients. But yeah, so you're going to want to have a balanced diet with the right kinds of fatty acids, the appropriate amounts of fruits and vegetables in the diet. And, of those servings of vegetables, I would say it's pretty standard you should probably strive for about at least a minimum of 6 servings of vegetables, a cup being 1 serving and half a cup cooked being 1 serving. And then of those 6 servings of vegetables you're getting throughout the day, try to make 4 of those some type of dark colored vegetable. So that way, you're getting nutrient dense, different bioflavonoids and other types of nourishment out of the vegetables. And then getting a couple servings of fruit in there. Mm-hmm. And then your lean proteins is what you're looking for. And you're not looking for like Fred Flintstone amounts of protein, but you do need to have a good, clean protein source.
Got it. Okay. Really, really.
So usually we're going to counsel someone on how, what does that even look like? Is breakfast going to be a couple of eggs and aside with some vegetables perhaps, and then maybe you have a snack later in the morning of some type of fruit, maybe some berries or blueberries or something like that. And then lunch, I usually counsel people as far as lunches go, whatever you make for dinner, make extra. And that way you have lunch the next day. You're not figuring out what, I have to cook something on the fly, or I need to prepare another meal. So you just make extra for dinner, and usually it's going to consist of some type of lean protein, like 4 to 6 ounces of a protein, get a couple vegetables in there. You can even do like some starchy vegetables to give you a little more substance, things like sweet potatoes or butternut squashes or spaghetti squash. And then even doing grains. And when I say grains, they should be a whole type of grain, whether it be like a brown rice or a quinoa, wild rice. Just the types of foods that we know haven't been manufactured to the point that they've lost all their nutrient. So mostly that basically means you have to ask yourself, how often do you eat stuff that comes out of a box? Mm-hmm. Mm-hmm. And if you find that most of your meals and snacks are coming out of a box or bag of some sort, you're probably eating way too much manufactured food and you're not getting a nutrient dense diet.
Got it. Yeah, that's good stuff.
But it involves a lot of cooking. So you're going to be preparing a lot of food, especially in the beginning when you're trying to embark on this journey. And you almost have to. And the reason why is because you need to understand what goes into your food. And once you have that understanding, now you can go out to eat and you know how to order off the menu and not just like ruin all the hard work you've been doing.
Yeah, I think that that's huge, like looking at the back, the back of labels. And I think that one of the first things that I noticed was that there was sugar in like everything that we use to, salad dressings and it's I think it was sugar and soybean oil. Those were like
Right.
the top, two things that I was noticing once I began looking at the back of labels, and really, moving away from things with labels and instead, preparing my own food in its entirety. So that's really, really helpful. So you talked about how to optimize your health before pregnancy. You're using nutrition.
Nutrition's one component, I would say, but there's other things to consider too. So the nutrition is allowing you to put those nutrients into your body, but something else I recommend for my women doing preconception care, and especially if there was any fertility struggles, is even doing macronutrient testing. And so this is a blood test that can be done, and we look at all your nutrient levels and then figure out, where do we support you? Where are you deficient? And so that way, you're nutritionally sound. Like, you have all of those cofactors. If you think, the biochemistry of the body and how everything's working, and especially if we're talking about root causes, you need to consider those pathways and how they're functioning and what cofactors, what nutrients do they need for those to run. And if you're deficient on some of those things, you can very easily have some, I don't know, even if we talk about, like, from the standpoint of, we talked about metabolic syndrome, and if someone is showing they're not pre-diabetic per se, but they're moving towards that way, and you look at their diet, you're like, well, you eat a really good diet. I don't know why you're moving in that direction. Sometimes it can be the nutrients that are required for the insulin to be able to bring in the glucose. So now we give you those nutrients, and now you can optimally function in those processes.
And so what are the names of some of those nutrients that you speak of?
So the one lab that I'll use, I wish I would have pulled up the lab stuff so I can just tell you exactly off there, but they're going to look at things like your B vitamins. So let's look at the whole list and individually at some of those. They're going to look at things like minerals.
Is magnesium one of those?
Yeah. So they'll look at things like magnesium, looking at like things like your iron levels, magnesium, zinc levels. I mentioned the B vitamins, vitamin A, vitamin D, vitamin C, vitamin E, looking at other things like inositol. We can look at other, even like some of the antioxidants in the body. So things like glutathione, how much of that is your body making? Do we need to support your body in that? And then even some of the fatty acids, we can see what is the ratio of your fatty acids within the body. Are you someone who needs to be eating a very highly dense diet with omega-3s in it? Or maybe you do get enough omega-3s and your balance is that you don't get enough of the omega-9s, or maybe you have too few of the 6s. So keep in mind, yes, 6s are pro-inflammatory, but we need to have some of those. You still need them. Mm-hmm. We just need the right balance of them. So doing a nutrient panel, I think, is an important component to that preconception care, making sure that you're in optimal health. The nutrition is a good component, but we also need to look at other things too, because again, it's about root causes. So what's determining your health? So now let's look at your exercise. How active are you? You don't have to be running a marathon, but I mean, you should be doing some standard walking, maybe some different types of activities, whether it be maybe you throw a yoga class in there or Pilates class or something. Maybe you do some Zumba, and not just exercise because I have to go do this dreadful exercise, but you should enjoy it. It should feel good. It should bring you joy to do. It should feel organic to you to like, let me move this way. And I look forward to moving this way. So, if you're someone who likes to dance, maybe it is Zumba because you get to move and break a sweat, get your heart up for, 45 minutes or so and something along those lines. But so exercise is a big component there. And then let's look at your sleep cycles. How are you sleeping? Do you sleep well? Are you rested? This is a huge thing. We know when people are super stressed out, they typically don't sleep well. So then do we need to talk about, is it as simple as your sleep hygiene? Or again, does this go back to your hormones? And now is it the hormone imbalance that's creating the dysfunction in sleep? So back to your earlier question about some of the symptoms, disrupted sleep cycles can also be a symptom in a hormone imbalance.
Yeah. So tell me, I hear a lot of folks who say that, I take melatonin to help me go to sleep. or I take Unisom to help me go to sleep. And I think that one of the things that has helped me not only with like my anxiety, but also with my sleep has been magnesium.
Yeah, magnesium's actually, I call it a magic mineral because it does so many things in the body. So there's over 300 processes in the body that require magnesium as a cofactor. So if you think about that, all these different processes have to function and they need magnesium in order to run their cycles. So, I mean, it's doing so much more than, yes, like some of the reasons I like to use it is it relaxes smooth muscles. So for someone with pregnancy and you're getting those ridiculous leg cramps,
oh my
I don't know if you've had any of those. Oh my God.
I had them my last pregnancy. But I swear, I think that because I take magnesium daily, I have not experienced
it will help tremendously with those. And it's completely safe for a pregnant woman to take those small doses of magnesium. But like I would tell my husband, it's like a gorilla just literally grabbed my calf and it will not let go.
It is like so painful. I used to get them in the middle of the night though. It's like I'm like sound asleep, and then the next thing I know, it feels like that gorilla has taken hold of my calf.
And yes, that's exactly what happened. I wake up screaming. I was like, "What's the matter? What's the matter?" I'm like grab my foot. I grab the foot. And it's like, it takes your breath away too. And it's like, okay, magnesium deficiency. Like, okay, I need to supplement a little bit more here. So like, so yes, it does relax smooth muscle. But another thing it does with pregnant women is the constipation. You're relaxing smooth muscle. So it makes it easier to have a bowel movement. And now you're not using some type of laxative, which you shouldn't be using anyway when you're pregnant. And you're able to actually have normal bowel movements.
Yep.
And then how about just the stress response? Like it definitely, because it relaxes smooth muscle, you'll feel more at ease, which is why taking it before bed can help you sleep way better than without if you are struggling with any type of sleep issues. And there's no side effects with it. That's the thing. So your biggest side effect with the magnesium is that you're going to end up with some soft stool. And if you're pregnant and constipated, that's not a bad side effect to have.
It is not.
Oh, the melatonin. You were talking about sleep.
Yeah, sleep.
So the problem with people with sleep is that when they use things like sleep aids, which yes, I agree, you need to get sleep. It's so important. You need to be rested. But the problem is when there's a dependency for some of these sleep aids, the sleep aid does not allow you to get into your deeper stages of REM sleep. And during that REM sleep is when your body's rejuvenating itself. But you're not waking rested with the use of sleep aids. If people are taking like the Unisom or Ambien or any of those other sleep aids. And then my issue with melatonin is melatonin's a hormone. Your body makes that. It's made in the pineal gland. And so why do you need melatonin? Again, I'm going to say, let's peel this back to your root cause. Is there a hormonal imbalance and what's driving it? Because the melatonin should be increasing naturally on its own in the evening when you're getting ready for bed, which means you've dimmed the lights, it's dark, so the receptors in your eyes aren't receiving these lights that say it's daytime, stay awake, which will inhibit your body from producing that melatonin. So sometimes it's, do we need to address your sleep hygiene so you can produce that melatonin? And then the other thing that works with melatonin is another hormone called cortisol, which is your stress hormone. So are you super stressed out and then your balances between the melatonin and cortisol is dysregulated? And because you're having high cortisol at night, you can't produce the melatonin that you need at night? So like those are some of the questions you need to ask when you're saying the only thing that makes me go to sleep at night is when I take the melatonin. Well, why is that? And so it's probably one of those two issues. So if you get off the electronic devices a couple hours before bed, start dimming the lights in your house after dinner, get into a good sleep hygiene routine, you usually find that give it some time, but those things will regulate on their own. And if they're not there, there's other things to start with first before you go to the melatonin. Because keep in mind, like I said, it's a hormone that your pineal gland's producing. And if you're giving it melatonin, well, guess what? Your pineal gland says, well, why would I produce more of this if you're giving it to me? Like, I'm going to let you do it. And then you actually down regulate its function. its production of that hormone. So you can do other things like L-theanine sometimes can be useful. You can use the magnesium. You can use, there's some botanicals that can be used as well. And then a lot of times it's usually the root cause is let's address your stress. Let's address the sleep hygiene. Most of that stuff ends up regulating itself anyway. Yeah. Right. Which is another one of those components of when we're talking about your optimal health preconception is, do you have a healthy amount of stress? Like we all have it. Like, what do you do with it? How do you manage it? How do you perceive it when it comes in? Right. So, sometimes it, that requires work, that requires, using, a therapist maybe to help you develop skills for coaching on managing that stress.
Yeah. One of the things that I found to be particularly helpful during high stress times and just in general has been meditation. And I know that it's probably said, a million times over, or I can't meditate. And it's like, no, you can meditate. I think that we just have a false understanding of what meditation entails. But like for someone whose mind is very hard to still, I find that meditation is super helpful, particularly guided meditations for me. But yeah, I find that to be helpful. And a walk outside.
Absolutely.
Fresh air.
Oh my God. Fresh air in nature will always bring the stress level down. So, and I, even like right now with the whole pandemic happening, I think a lot of people are really feeling stressed from all the unknown. And, that's huge. It's just getting outside for a walk. And it's like, everyone's working from home and you don't ever leave your house. It's like you can get outside a couple times a day for a 10, 15-minute walk and just clear your head, breathe some fresh air, and then come back inside and go back to your home workstation.
Yep. It's the simple things. Absolutely. Mm-hmm. Absolutely.
Another thing I didn't bring up is environmental exposures are huge for preconception care. You have to start considering these things because we need to start detoxifying the body and get them out of the body.
So what do you mean by that? So are these like products that we have in our homes or?
Oh, absolutely. Yeah.
Okay.
Most of the stuff, like sometimes look under your kitchen sink. What are you cleaning your house with? Are you using Lysol and scrubbing bubbles and Fabuloso. I love Fabuloso. It smells great. But like some of these things are actually toxic and they can make us sick. And it's not that it's not one thing that's going to make you sick. The idea is it's the cumulative load that's going to make you sick. So it's like the, and actually this goes back to hormones too. We look at things that are endocrine disruptors. How about plastics? What are you storing your food in? What are you cooking your food in? Mm-hmm. So those are huge things to think about. Do you throw, my favorite is when patients tell me how they use, because they're increasing their vegetables in their diet. Because I recommended, you got to eat all these servings of vegetables now. So they tell me that they buy, those frozen bags of vegetables. And because it's so convenient and on the bag, it says you can just throw the whole bag in the microwave and steam it. So now they're microwaving their plastic bag of frozen vegetables, which I'm not opposed to frozen vegetables. But I am opposed to cooking them in the plastic bag in the microwave. It's get a pan out, cook them on your stove, or if you really need to use the microwave, put them in a glass container and then put them back in the microwave. And the reason why is because plastics specifically, they mimic estrogen in the body. So now you have this endocrine disruptor. So here is a source of disruption happening to your hormones that you may or may not have even been aware of. And things in plastics, they're actually very difficult to metabolize out of the body. So that's why if you can just try to avoid them. I think I gave you one of the books I recommended for you is you were asking me what the soup was. And
the tea, the tea.
Oh, sorry. The tea. What's the tea? Sorry. What's in the tea? So one of the, actually, I love this book. I thought it was a great book and it made it very simple. So it wasn't so overwhelming for people. It broke it down into these different categories and it's Toxic home, conscious home. That's what it's called. And so he does a great job of just breaking down what simple things you can do. Like, even we talked about cleaning your house. Like, most of your stuff in your house can be cleaned with something that's completely non-toxic, like a solution of vinegar and water or baking soda and water. Simple things like, if you are using plastics, there's a whole chapter in there that he explains what the number on the plastics mean and which one of those numbers are actually food safe. Like, so they're food quality grade plastics, which would be better. Like, so if you're buying stuff that's comes in plastic, you want it to have like a number 5 is actually one of the highest grades of plastics for food quality grade.
So what about the
like
folks who buy like the little plastic lunch containers and stuff like that, and it says BPA free?
So you still want to look at the number. You still want to make sure that it's one of those safe numbers that are on there.
Okay.
Yeah. And that's fine, but definitely don't heat your food in those. Even though it is that high number, I still wouldn't heat my food in it.
Interesting. So it can literally disrupt your endocrine system.
Oh, absolutely. Even some of the ingredients in these hand sanitizers, which is funny. It's like, this has already been listed on the EPA's website of this, these sources of the ingredients in some of these hand sanitizers and how they're endocrine disruptors and can actually disrupt thyroid functions for people. And so I think it would be interesting to see if we see an upregulation or an uptick in people all of a sudden with thyroid dysfunction with all the use of hand sanitizer instead of just good old fashioned soap and water and washing our hands.
So what about the plug-ins and the smell good candles and, all of those things? Because, we love our house to smell good, but
unfortunately a lot of the synthetic fragrance tends to have a toxic load along with it as well. And I know you can do things like soy-based candles burn cleaner than some of the other ones. So there are options for like a cleaner source of it, if that's something that you really like to have in your house.
Yeah, I definitely do the soy-based candles. I love a good candle, but I did give up the plug-ins. And it's interesting. I grew up in my home my mom always had the house smelling good. It was always cleaning up with, pine sol, and she had a million plug-ins all around the house. And, I wonder if those were some of the things that really contributed to me getting fibroids, particularly at such a young age.
And they could, but again, keep in mind, it's not one thing that does it. It's that cumulative load. So it's all of those things. So the exposures, environmental exposures, and then let's throw, a poor diet on top of that, and high stress and poor sleep, and there's not enough time in the day to get good exercise in. So, I mean, you throw all these disruptions in, and there you go. There's your recipe for disaster.
That's a lot. So I mentioned before that Mercier Therapy was a part of my wellness plan with you. Can you tell us what exactly is Mercier Therapy? What does it do, and what are its benefits, and also who are its ideal candidates?
So this is something else, depending on the candidate, might be part of a preconception plan for somebody. So Mercier Therapy itself, it's a visceral manipulation. So it's done through the abdomen. So it's not, it's about positioning of the organs and providing optimal circulation to these organs. So for example, somebody who has had any type of abdominal surgery is going to have a whole lot of scar tissue in there. And that can be affecting things like positioning of the organ, depending on where the scar tissue is and what type of procedure was done and how it was done. So just by the nature of the procedure is, I don't want to call it, it's not a massage. So I don't want to call it a massage.
No, and it doesn't feel like one.
No, but you're basically manipulating the structures that are in the pelvis. And so we're moving around some of the soft tissue. Yes. And then the visceral organs that are there as well. And like I said, it's mostly about increasing that blood flow and that position of the organ. So someone who, like I said, may be a good candidate for that is if you've had any type of abdominal surgery, if you have had somebody with something like endometriosis. Like, so for example, Jenny Mercier is who developed this technique, and she actually has a documentary. You can find it on Amazon. She explains this whole thing. She goes into a lot of detail about it, and it's probably going to do it more justice than the way I'm explaining it. But she discovered this technique because she figured it out on herself. She herself has endometriosis, and she was told that in order for her to conceive, that she would probably have to have some type of intervention. In order to do that, whether it be IVF or whatever intervention she would have to possibly conceive, because her endometriosis was so bad. But in addition to that, and anyone who has that knows that when you do get your period, it's extremely painful. And so she started just by doing self-manipulation. She started figuring out like, hey, my period's not so bad anymore. These pains have gone away. And so this is where it like sprung the whole idea of this, the concept for this therapy to begin with. And after she was working on herself, lo and behold, she got pregnant with her first child, just naturally without any intervention. And that's kind of where it came from. So I've found also that women with things like endometriosis, PCOS, and other painful periods that they have a painful period, but maybe it hasn't been diagnosed as endometriosis, also benefit from the therapy. And so typically what you end up seeing is after you've gone through we'll recommend 6 sessions. And after they've gone through that, you will see changes even in your menstrual cycle, in the flow of your menstrual cycle. If you were someone who had a lot of clotting during your menstrual cycle, all of a sudden you don't have these crazy clots. Or if you had super heavy periods where it was like a floodgate that opened, all of a sudden you're like, whoa, what happened? I'm like a normal person with a normal menstrual cycle. So you see those changes happen for those types of uterine issues.
And what about for women who, I know a number of women actually who have had like a lot of pelvic pain post-pregnancy?
Yeah. So
would that be
depending on
helpful?
the pregnancy,
Mm-hmm.
and especially if you're post C-section, absolutely. Post C-section. And if you want to have another baby, Mercier Therapy is definitely something you would want to consider having done after your recovery. Obviously you want to wait, 6 to 8 weeks post recovery, and then you can go ahead and proceed with that. But yeah, that would be extremely beneficial. And again, it's about the scar tissue, the adhesions that develop because of the scar tissue. Sometimes it can even be where the adhesions are around where maybe like the tubes, and not allowing for, proper, like again, when I say positioning, sometimes so that the sperm actually can reach its target area. If there's any type of blockage there, sometimes you'll get things like mucus can create a blockage there. And just by manipulating, we allow it to kind of move through. And now we've opened up this area to allow the basically sperm to come in, fertilize the egg, and then that egg needs to come back through the tube and then implant into the uterus. So if you think about the uterus and providing adequate blood flow to that uterus, that means that you're going to actually build a healthy, viable endometrial wall for that implantation to happen in. Mm-hmm. And that's huge because you'll find, some people, even when they are using interventions and they're not able to, you see this very commonly with women who are having IVF done. They go in for that ultrasound and they're measuring the lining of the uterus to make sure that it's thick enough. And so some of them will struggle where they're just not getting a thick enough layer there so the implantation can never happen. Mm-hmm. And so everything's ready to go, but the endometrial wall is not thick enough yet. Mercier Therapy might be a good option for that person to, again, promote circulation so that those arteries that are there building that wall have all the nutrients there because you've increased that circulation.
Wow, that's fascinating. So I will say that Mercier Therapy, it does not feel like a massage. It is not painful. I didn't find it to be painful.
It's odd.
It's odd. It's uncomfortable. That's what I'll say. It's like you haven't had anyone because, it's external. it just feels a little weird, but I think that it was totally worth it. And it's not something that, I was scared to do because it was so painful or it was so uncomfortable. But I think that, it worked wonders.
Would you agree like the first session was a little uncomfortable, and then as you move through the sessions, it becomes less uncomfortable? And I usually tell people by the 5th or 6th one, you're usually finally like ready to take a nap.
Yeah, no,
you finally
definitely
work through the adhesions there and you're like ready for a nap.
But you also, I'm also very mindful that when I, started Mercier Therapy, I think I was 7 weeks out of my surgery. So, that could have made a difference as well. But, no less, I think that it was totally worth it. And it's something that I have suggested time over and time again to many women. So I think that, all in all, Mercier Therapy is definitely, it has its many benefits, and I can't recommend it more. So I guess one of my final questions would be around, okay, so now I know this information about, how we can really get to the root cause of a lot of my different ailments. How do you suggest going about finding either a functional medicine practitioner or an integrative doctor? And then lastly, how to find a Mercier therapist. And I think that Mercier Therapy is also specific to like Illinois, if I'm not mistaken, because
no, she does trainings for actually all over the country, and I would say even the world. I remember there was a couple practitioners when I took the certification that were from Canada that were there, and I know she has a few other countries where she has practitioners that have come to the U.S. for the training.
Okay, so awesome.
It really is kind of making its way. And becoming more known and recognized as a therapy for infertility. So we've even worked with a couple fertility clinics that are in Chicago that were referring patients for this therapy.
Oh, wow.
Yeah. So I mean, it is becoming an accepted form of treatment for fertility. And the fact that even, reproductive endocrinologists were referring patients for this therapy, I mean, that says a lot how far it's coming and will continue to come.
Absolutely. So, well, how would you go about finding someone? So, Dr. Sandra, you are in Chicago or the Chicago area, in Schaumburg specifically. I'll make sure to include your contact information and stuff in the show notes. But for the folks who may not be in Chicago and maybe elsewhere, how would you recommend going about finding a functional medicine practitioner or an integrative doctor?
So, there's a couple of different organizations that certify functional medicine doctors, if that's something that you were looking for. So IFM is one of those organizations. If you were to go to their website, you would be able to get a list of doctors that have gone through their education and are certified through that. If you were looking for someone, that's across the board, from chiropractors to DOs to MDs to NDs, can all obtain that certificate through IFM. If it's something like chiropractors, we have it's DABC, which is basically it's a board certified chiropractic internist. So this type of person would also have that type of knowledge and perspective of looking at root causes. And then given that they're chiropractors, they tend to be a little bit more on the alternative side. So if that's something that you're looking for as an option, there's another organization that is College of Lifestyle Medicine. They certify as well, and they promote looking at root causes and addressing somebody's root cause as well.
Got it. So would I found you as a part of a wellness center, right? So,
Mm-hmm.
and it was recommended specifically as a wellness center. So, if you're looking for these types of practitioners, you could go directly to these websites. But like, say I'm the type that I'm just like, oh, I want to go to Google, right?
Right.
Is that not recommended, or would you suggest that they look for a wellness center, or?
You can look for a wellness center. And then you might just want to ask some questions, even when you're making the appointment. If it's like the nurse who is taking the phone call, or the medical assistant that's in the office, they'll always be able to give you some good insight on kind of the perspective of that doctor. Sometimes you're just taking a chance too. So it's hard to say. You may go to that visit and have your list of questions of concerns. And, if you're so here's the deal. If you're someone who's looking for a functional medicine doctor, you've probably already been through the ringer, and you probably have already heard the spiel about what your diagnosis is or lack of diagnosis that and so you're going to find that out when you go to that visit. And if you have questions about, some of the alternatives and maybe a different perspective or viewpoint, and you're not getting that from that practitioner, it's probably not the right practitioner you're looking for.
Got it. So do you have any questions that you would recommend asking prior to going to see a practitioner?
I guess it depends on what you're going for. So like with reproductive endocrinology, like you can ask questions to them of, what are their thoughts on using acupuncture or, some of these other alternatives like the Mercier Therapy. Do they think nutrition plays a role in their fertility? Like you're going to see the response from that person. And you're going to know if it's somebody who is looking at you holistically, meaning the whole person, or if they're just looking at, we just need to regulate your hormones so that you ovulate and then you can try getting pregnant and call it a day, instead of looking at, like I said, holistically, that whole person. So everything that we talked about with the preconception care. And then something I didn't mention with the preconception care, like what's the purpose of it? Why go through all this trouble, right?
Mm-hmm.
And the reason why you go through all this trouble is because it's about having the best egg quality available. And this isn't just for the women, this is for the men too. The men need to go through these nutritional changes. They need to go through these lifestyle changes, managing their stress, sleeping well, because it's their sperm quality also. So this is the DNA that's going to come together and replicate and make what is your child, right? So you want to have basically your best foot forward. And so, if you're someone who comes from, maybe you're predisposed to some genetic problems, like maybe you have a history of diabetes in your family. So going through the process of having that healthy BMI, controlled blood glucose, you've reduced your risk factors for those metabolic syndrome type diseases, then I'm going on this whole other tangent. I don't even know if I should go there about genetics and epigenetics and how we turn these things on and off. And so your healthy lifestyle allows you to turn off these genes that would otherwise express themselves. So in essence, you're allowing yourself to have the healthiest egg quality and the healthiest sperm quality possible to conceive this baby that you're trying to conceive, which means a healthier baby. And even before the healthy baby, it's during that pregnancy, it's that healthy pregnancy, which means low complications, low risk factors, low need for interventions, low possibility of complications throughout the pregnancy, and importantly, during your delivery. That's why you do it all. It's not like, I just need to be healthy and it's my wellness. You're doing it it's not about you anymore. It's about this baby that you're going to have. So even when we talk about diet and people say, I did a Whole30 and now I'm back to my, McDonald's drive-through and my Jimmy John's and my Chipotle and whatever other, on the go food that you're constantly eating. Well, that really didn't do you much good. It needs to be a lifestyle change that you take with moving forward throughout your whole pregnancy. And then postpartum, because if you're nursing, you need that highly nutritious food to support your body throughout nursing. And then here comes this baby who's now eating whole foods. And you want to teach them to eat this healthy, nutritious food so that they can continue to grow and strive in the
Absolutely.
optimal way that they can. So it becomes this ongoing process through your whole family.
Yep. Yep.
And for your lifetime.
And for your
And your
lifetime.
baby's lifetime.
Yeah, definitely changing up a lot of the ways in which we were raised, particularly as people of color. It's a hard process, but I think that, for the women, especially who are, really, really wanting to get pregnant, and, it's sometimes, there can be even a grave sense of of desperation. I think that in desperation, why not take the more holistic approach, to making sure that not only you're healthy, but your baby is healthy as well. So,
right. The thing to keep in mind, though, is that it's when you take this alternative approach to it, it's not going to happen overnight. So if you've been at this for a while and you're like, I want to be pregnant yesterday, it's not going to happen that way. You got to take a step back. You got to take some time. Like I said, you got to prepare the space. And for some people, it's, 6 months. Other people need that 9 to 12 months in order to do that. And then you start trying. And you'd be surprised how quickly somebody can conceive once they've taken the time to complete that process.
Yeah, absolutely. I mean, I think about when I first began the full process. So I had my surgery in, let's say, mid-August. I came to you in the latter part of September, let's just say October. And then I actually conceived right around early or late April. So my process was not like a quick process at all. But it was a process it was one that I just had to trust. This wasn't something that, you can just quickly Google and find, this is my process. And so part of it is making sure that you really truly believe in the practitioner that you are going to, that they are knowledgeable. And I think that because I began to geek out on all things functional medicine and alternative health, it was always just a pure joy to come into the office and to visit. And you guys became a real part of my community and a huge part of my healing journey. So I am greatly appreciative of that. So, Doc, you have called the tea the soup. But I am, but in the soup, you
Sorry
have
about that.
No worries at all. In the soup, you got many ingredients too. And so I'm really wondering, what do you have as a part of your wellness toolkit? For one, and then lastly, what are some of the things, if you want to become more knowledgeable about your reproductive health, how to change up some things in your home environment to make it more healthy, and to learn a little bit more about Mercier Therapy?
So there's a couple of resources I would recommend for those things. The Mercier Therapy actually has a documentary that Jenny Mercier put together, and you can find that on Amazon. So her documentary is called Fertility, The Shared Journey with Mercier Therapy. And she goes into the whole, it's a great little documentary that she put together about this protocol and who it benefits. And so if you're thinking this might be something for you, I'd recommend, I think it's, what is it, like $3.99 or something like that on Amazon. You can watch it. And I think that would really help give you a better understanding of what this therapy is. And if you think you might be the right candidate for it. The other one we talked about is really understanding your body. And the book I recommend for that is called Taking Charge of Your Fertility. And I think this one's important because you need to understand how your body functions. You need to understand what is happening throughout your menstrual cycle and how those hormones play a role and they work together, and how the egg is released and when ovulation occurs. And that when ovulation occurs is just as important as if it occurs at all. You can't have it occurring too late in the cycle. It needs to be just at the right time. So and understanding your cervical mucus is huge. And there's a great little section in there with detailed pictures that explains what you're looking for. So that's a great book for wanting more information about understanding your body. And then as far as kind of like cleaning up the lifestyle, Toxic Home, Conscious Home is another book that I recommend. that really it's pretty straightforward. And I think it presents some of these changes you can make in your household and in your life in a way that's not so overwhelming. Otherwise, I mean, it's crazy to think even from the nutritional standpoint, we talk about making some of these changes. Maybe it's instead of taking things out of your diet, let's try adding some things into your diet. Why don't we start with, looking at how many servings of vegetables are actually in your diet? And maybe that's the first thing that you work on and complete that, make that a new habit instead of something that you're just, like a crash diet or something like that.
And so I think that we are maybe about a week apart in terms of our due dates. And so I'm wondering, like, what are you currently loving? What's bringing you joy besides that sandwich at Whole Foods?
Oh man, that sandwich was good. That pregnancy craving that day. It's the excitement of having this baby and, meeting this new creature is just, I don't know. It's just pregnancy. It's weird because you feel terrible. I mean, no one actually feels great when you're pregnant, but at the same time, it's such a special time and special experience that you're going through. So I just try to enjoy as much as I can of it. But, one other thing is, like, we chose not to find out the sex of the baby. So, like, I'm actually really looking forward to find out, like, what do we have here? Like, who's going to, grace us with their presence? And so I'm really looking forward actually to the delivery, just so that I can finally meet who this person in here that's been flopping around. And
yeah, mine does baby Tybo all day.
Oh gosh, so bizarre. It's like, what are you doing in there?
I just talked to her like, "Hi, little baby." Yeah, let her know that mama hears you, mama feels you, and I am with you.
Well, thank you so much for having me on, and it was such a pleasure. And I hope I hope this ends up being useful and works out. And I hope the information I gave was useful and that your listeners find it helpful. And I mean, it's my pleasure to share this information with people on their fertility journeys. And people need to know more, that they have more options.
Thank you so much for listening. It is truly my hope that you both enjoyed and gained something from it. And if so, be sure to share this episode with another queen that could benefit. Also, if you are willing and able, please leave me a 5-star review wherever you consume your podcast. That is how we spread the good word, y'all. And in the meantime, be sure to follow us on all social media platforms at the Sister Circle Podcast. And be sure to check out the website, thesistercirclepodcast.com. There you can subscribe to our mailing list to ensure you get reminders about when new episodes drop and receive our monthly newsletter that's filled with great resources. You can check out our show notes, resources, and blog. And you can send me a message if you want to be on the show, have an idea for the show, would like to collaborate, or sponsor the show. With love, Faith.